Did you know that in Japan, more than 1 in 10 people are now aged 80 or older? And it's not just Japan, both China and South Korea are also facing a significant increase in their elderly populations. By next year, over 10 million people in South Korea will be 65 or older, marking 20% of its population as senior citizens. These numbers are more than just statistics, they represent a profound shift in the demographics of East Asia. In this video, we're going to talk about a pressing issue that affects millions of families across East Asia, the rapidly aging populations in China, South Korea, and Japan. This demographic shift is not just a future concern, it's a reality that's already shaping the economic, social, and cultural landscapes of these countries. In China, the proportion of people aged 60 and above is projected to rise from 17.8% in 2020 to 32% by 2040. This shift is putting immense pressure on the country's healthcare system and pension funds. Similarly, Japan, which consistently has the oldest population in the world, is seeing nearly a third of its population over the age of 65. South Korea is not far behind. By 2025, it's set to become a super-aged society, with 20% of its population aged 65 or older. These countries are like ships navigating the same stormy seas but using different strategies and tools. We'll explore how each is addressing these challenges, from innovative healthcare solutions to cultural shifts in family dynamics. Stay with us as we unpack these fascinating and critical issues, and see how East Asia is preparing for a future where the elderly are not just surviving but thriving. Now, let's break down the demographic challenges faced by China, South Korea, and Japan in detail. China is facing a significant demographic shift. As of now, about 19.8% of China's population is aged 60 or older, and this figure is expected to rise to 32% by 2040. This means that nearly 1 in 3 Chinese citizens will be elderly in just a couple of decades. The root of this issue can be traced back to the one-child policy, which was implemented in 1980 to curb population growth but has led to an imbalanced age structure. The policy was phased out in 2016, but its long-term effects persist, with a low birth rate and a rapidly aging population. Life expectancy in China has also increased significantly, reaching around 77 years. While this is a positive indicator of improved healthcare and living standards, it also means a larger elderly population that requires care and financial support. This growing demographic is putting immense pressure on the country's healthcare system and pension funds. Hospitals and care facilities are struggling to keep up with the demand, and the pension system, which relies on current workers to pay for retirees, is facing sustainability issues as the workforce shrinks relative to the retired population. South Korea is experiencing a similar demographic trend. By 2024, over 10 million South Koreans, or 20% of the population, will be aged 65 or older, marking the country as a super-aged society. The country's birth rate is among the lowest in the world, which exacerbates the problem. In 2020, South Korea recorded more deaths than births for the first time, signaling a population decline that will only intensify the aging issue. The working-age population in South Korea is also shrinking. From 37 million in 2021, it is projected to decrease steadily in the coming years. This decline means fewer workers are available to support the growing number of elderly citizens. The economic implications are significant, with potential labor shortages and increased pressure on social security and healthcare systems. The government has been trying various measures, such as financial incentives for families to have more children and policies to extend working years, but these efforts have yet to yield substantial results. Japan is the most pronounced example of an aging society. Nearly 1/3 of its population is over the age of 65, and more than 1 in 10 Japanese people are now aged 80 or older. Japan's population has been aging for decades, leading to a range of economic and social challenges. The birth rate has been low for a long time, and life expectancy is one of the highest in the world, further tilting the demographic balance towards the elderly. The economic impact of this aging population is profound. Japan's GDP growth has been sluggish, and the country faces significant public finance strains due to rising healthcare and pension costs. Prime Minister Fumio Kishida highlighted in 2023 that Japan is at a crossroads, facing the twin threats of falling birth rates and an increasing elderly population, which could undermine the country's ability to function effectively as a society. When comparing these 3 countries, we see both commonalities and unique aspects. All 3 nations are experiencing rapid increases in their elderly populations, which puts pressure on healthcare systems and pension funds. However, the severity and progression of these issues vary. Aging rates, Japan has the highest proportion of elderly citizens, followed by South Korea, which is catching up quickly, and then China, which has a slightly younger demographic but is aging rapidly. Economic implications: all three countries face economic challenges due to shrinking workforces and increasing elderly populations. However, Japan's long-standing experience with an aging population gives it a slightly different perspective, with more established policies and a clearer view of the long-term impacts. Policy responses: Japan has been proactive for longer, implementing various measures to support its elderly population and integrate them into the workforce. South Korea and China are now intensifying their efforts, introducing policies to boost birth rates, adjust retirement ages, and expand elderly care infrastructure. Each country's approach reflects its unique demographic trends and cultural context. Understanding these shifts helps us appreciate the complex economic and social dynamics in East Asia today. By addressing these challenges thoughtfully, these nations can better support their aging populations and maintain social and economic stability. Next, let's dive into the economic implications of an aging population in China, South Korea, and Japan. China's aging population poses several economic challenges. First, rising healthcare costs are a significant concern. With more elderly citizens requiring medical attention, the healthcare system is under tremendous pressure. In 2021, healthcare spending in China reached nearly $1.2 trillion, a massive increase from just $55 billion in 2000. This dramatic rise is due to the increased prevalence of age-related diseases and the need for long-term care. The pension system in China is also strained. The old age dependency ratio is expected to reach nearly 52% by mid-century, meaning for every 2 working-age individuals, there will be 1 person over 65. This puts a lot of pressure on the current workforce to support retirees, which could lead to higher taxes or reduced pension benefits. Additionally, the shrinking workforce could hinder economic growth, as fewer young workers are available to drive the economy forward. South Korea faces similar economic challenges. Healthcare costs are rising rapidly due to the increasing number of elderly citizens. By 2024, more than 10 million South Koreans will be aged 65 or older, making up 20% of the population. This superaged society status means the country needs to invest heavily in healthcare infrastructure to cater to its aging population. The pension system in South Korea is also under significant stress. With a declining birth rate and shrinking working-age population, there are fewer contributors to the pension fund, while the number of beneficiaries continues to grow. This imbalance necessitates urgent pension reforms to ensure sustainability. Additionally, the reduction in the labor force could lead to labor shortages, which would impact productivity and economic growth. Japan is perhaps the most well-known example of an aging society. Nearly 1/3 of its population is over the age of 65, with more than 1 in 10 people aged 80 or older. This demographic shift has severe economic implications. The strain on public finances is substantial, with rising costs for healthcare and pensions. In 2020, the International Monetary Fund predicted that Japan's aging and shrinking population would strain public finances as age-related spending rises while the tax base shrinks. Labor shortages are a significant issue in Japan. With a smaller working-age population, the country struggles to maintain its economic growth. Despite these challenges, Japan remains the second-largest economy among the G7 countries. However, the future sustainability of its economic model is in question as the population continues to age and shrink. While all three countries face similar issues related to an aging population, the economic impacts differ due to their unique social and economic structures. China has a relatively younger population compared to Japan and South Korea, but it is aging rapidly. The economic challenges are compounded by the country's large population base and the need to reform its pension system and healthcare infrastructure quickly. South Korea is facing a sharp increase in its elderly population and one of the lowest birth rates in the world. The country needs comprehensive reforms in its pension and healthcare systems to manage these changes. Japan has the oldest population and has been dealing with these issues for longer. The country's experience provides valuable lessons for China and South Korea, but it also highlights the long-term economic strain that an aging population can impose. Understanding these economic implications helps us appreciate the complexity of managing aging populations and the need for strategic planning and reforms in healthcare, pensions, and labor markets. Each country must tailor its approach to its unique demographic and economic circumstances to ensure a stable and prosperous future. Let's talk about what China, South Korea, and Japan are doing to address the challenges posed by their aging populations. China has recognized the need for comprehensive strategies to manage its aging population. One of the primary measures is raising the retirement age. Currently, men retire at 60, while women retire at 55, white-collar jobs, or 50, blue-collar jobs. The government plans to gradually increase the retirement age to 65 for both men and women by 2045, extending the working years progressively to avoid a sudden shift. This approach aims to ease the pension system's strain by keeping more people in the workforce for a longer period. Additionally, China is encouraging higher birth rates through various incentives. These include tax breaks, extended maternity and paternity leave, and cash payments for families with a second or third child. For example, in cities like Hangzhou, families receive substantial financial bonuses for having more children. China is also expanding elder care services. The 14th Five-Year Plan includes increasing the number of nursing beds in elder care facilities and improving geriatric training for healthcare professionals. The aim is to build a more robust support system for the elderly, ensuring they receive adequate care as the population ages. South Korea is tackling its aging population with a mix of financial incentives and policy reforms. The government offers monthly stipends to families with newborns, and plans to introduce lower mortgage rates to make housing more affordable, addressing one of the significant barriers to higher birth rates. Retirement age policies are also under review in South Korea. While the country has not yet raised the retirement age, there are discussions about this move to mitigate the economic impact of a shrinking workforce. In the meantime, the government is focusing on healthcare reforms to better support the elderly. This includes improving long-term care services and expanding healthcare coverage for age-related illnesses. Japan, with the world's oldest population, has been implementing several innovative solutions. One key strategy is the promotion of technological innovations in elder care. Japan is a leader in developing robots and AI to assist with elderly care, aiming to reduce the burden on human caregivers and improve care quality. Pension reforms are another critical area. Japan has raised the retirement age to 65 and is considering further increases. The government is also encouraging elderly workforce participation through policies that support flexible working conditions and part-time opportunities for older workers. Moreover, Japan is addressing the issue of low birth rates by offering financial incentives and extensive child-rearing support. These include subsidies for childcare, free preschool education, and support for work-life balance to encourage families to have more children. When comparing these approaches, we see varying levels of effectiveness and public reception. China's gradual approach to raising the retirement age and its financial incentives for families are pragmatic but face resistance from those who prefer shorter working lives. South Korea's financial incentives are comprehensive, but the real challenge lies in cultural attitudes towards large families and the economic pressures on young couples. Japan's technological innovations and flexible work policies for the elderly are cutting-edge, but the country still struggles with low birth rates and the high costs of supporting an aging population. Each country is tailoring its strategies to its unique demographic challenges, but the shared goal is clear: to create a sustainable future where the elderly are supported, and the younger generations are not overburdened. By learning from each other and continuously adapting their policies, these nations can better navigate the complex landscape of an aging society. Next, let's explore how the aging population is reshaping the social and cultural landscapes in China, South Korea, and Japan. In China, the traditional family structure is facing significant challenges due to the demographic shift. Historically, Chinese families have operated on the principle of raising children to provide for old age. This concept is deeply rooted in Confucian values, where children are expected to care for their aging parents. However, with the rapid aging population and the effects of the one-child policy, this traditional support system is under strain. Imagine a typical Chinese household where one child is responsible for caring for two parents and possibly for grandparents. This 4-2-1 family structure places immense pressure on the younger generation. They have to balance their careers, personal lives, and the care of their elderly relatives. As a result, more elderly care facilities are being developed, but this shift also brings about cultural changes as institutional care becomes more accepted over familial care. South Korea's cultural attitudes towards aging are also evolving. Traditionally, elder respect is a cornerstone of Korean society, influenced by Confucianism. Elderly parents often live with their children, and there is a strong expectation for familial support. However, like China, South Korea is grappling with the reality of a rapidly aging population and low birth rates. To address these challenges, the government is implementing policies to support families, such as financial incentives for having more children and improving elder care services. Despite these efforts, there is still a significant burden on middle-aged Koreans, who are often referred to as the sandwich generation because they are caught between caring for their children and their aging parents. This situation is leading to increased acceptance of professional elder care services and a gradual shift away from traditional family-based support. Japan, with its highly aged population, has long upheld the cultural value of ikigai, or having a life purpose, which remains influential in how the elderly are perceived and treated. Japanese society places a high value on the contributions and wisdom of its older citizens. Respect for the elderly is deeply embedded in Japanese culture, and many older adults remain active in their communities well into their senior years. Japan is also leveraging technological innovations to support its aging population. From robotic caregivers to smart home technologies, Japan is at the forefront of integrating tech solutions to help elderly individuals maintain their independence and dignity. These innovations are not just practical but also culturally significant, as they allow older adults to continue contributing to society, aligning with the concept of ikigai. When we compare these three countries, the cultural differences become evident in how they address the challenges of an aging population. China is shifting from a strong familial care model to more institutional care due to demographic pressures, but this transition is challenging traditional values. South Korea is in a similar boat, with a strong cultural expectation for family support being strained by economic and demographic realities. The government's incentives and support services are steps towards alleviating this burden, but cultural attitudes are slower to change. Japan, on the other hand, has embraced technological innovation while maintaining deep respect for its elderly. This blend of tradition and modernity helps Japan manage its aging population effectively, though challenges remain. These cultural perspectives significantly influence the effectiveness and public reception of policies addressing aging populations. In China and South Korea, the transition away from traditional family-based support is gradual and met with resistance. In Japan, however, the integration of technology with cultural values provides a more seamless adaptation to the demographic shift. Understanding these nuances helps us appreciate the diverse approaches and the cultural depth behind each country's strategies. Let's explore some real-life examples of how China, South Korea, and Japan are dealing with their aging populations through specific family and community programs. In China, the changing demographics are challenging traditional family structures. One notable example is the community care program in Beijing's Chaoyang district. This program provides comprehensive services to elderly residents, including daily health checkups, meal delivery, and social activities. The aim is to reduce the burden on families and ensure that older adults receive the care they need. For instance, Mrs. Wang, an 85-year-old widow, benefits from this program by receiving daily visits from care workers who help her with household chores and provide companionship. This community support allows her to live independently while staying connected with others, showcasing a successful adaptation to the demographic shift. South Korea is also making strides in supporting its aging population through government initiatives. One such initiative is the Long-Term Care Insurance program, which provides financial support and services to the elderly. This program has helped many families, like the Kim family in Seoul, where the elderly parents receive subsidized care services. Mr. Kim, a retired teacher, and his wife benefit from in-home care services that include regular health monitoring and assistance with daily activities. These services not only improve their quality of life but also relieve their children from the full-time responsibility of caregiving, allowing them to maintain their careers and personal lives. Japan, facing the most severe aging crisis, has turned to technological innovations to support its elderly population. The city of Fukuoka has implemented an advanced elder care program using robotic caregivers. These robots, like the popular Paro therapeutic robot Seal, provide companionship and assist with daily tasks. Mr. Tanaka, an 82-year-old resident, uses a robot named Pepper for medication reminders and interactive games that help keep his mind active. This use of technology not only addresses the shortage of human caregivers but also enhances the well-being of elderly residents by providing consistent and personalized care. When comparing these approaches, it's clear that each country is finding unique ways to adapt to the aging population challenge, rooted in their cultural and social contexts. China focuses on community-based support systems that blend traditional family values with modern care services, aiming to maintain the elderly's independence while easing family burdens. South Korea emphasizes government-supported programs like long-term care insurance, which provide financial assistance and professional care services to elderly citizens, ensuring they receive adequate support without overwhelming their families. Japan leverages technological advancements to address its aging population, integrating robotic caregivers into daily life to compensate for the caregiver shortage and enhance the quality of elder care. These examples highlight how different strategies can effectively address the same overarching issue of an aging population, tailored to fit the specific needs and cultural contexts of each country. By examining these real-life case studies, we gain a deeper understanding of the practical impacts and adaptations happening on the ground. Let's wrap up what we've discussed today about the aging populations in China, South Korea, and Japan. We started by looking at the demographic challenges each country faces. In China, the aging population is growing rapidly, putting pressure on healthcare and pension systems. We saw how traditional family structures are being challenged and how community programs are stepping in to help. South Korea faces similar issues with an aging society and low birth rates. Their government initiatives, like long-term care insurance, are helping families manage the burden of elder care. Japan, with the oldest population, is leveraging technology with innovative solutions like robotic caregivers to support their elderly citizens while maintaining cultural values like ikigai. Looking ahead, the aging populations in these East Asian countries will continue to shape their economic and social landscapes. The pressures on healthcare and pension systems will likely increase, and each country will need to adapt further. China might see more community-based programs and a push for higher birth rates to balance the demographic scales. South Korea will probably expand its government support programs and might see a cultural shift towards more professional elder care. Japan will continue to innovate with technology, potentially setting a global standard for elder care solutions. On a global scale, the strategies and innovations from these countries can serve as valuable lessons for other nations facing similar demographic shifts. The integration of technology in elder care, government support for families, and community-based solutions are all areas where East Asia is leading the way. As the world population continues to age, these approaches could influence global policies and practices, helping to create sustainable and supportive environments for the elderly everywhere. Thanks for sticking with us through this comprehensive look at aging populations in East Asia. How do you think these countries are handling their aging populations? What solutions do you find most promising? Don't forget to subscribe to our channel and hit the notification bell so you don't miss out on our future videos. Stay tuned for more comparative analyses and in-depth discussions on important global issues. See you next time.